When reviewing patients referred to ENT post A&E, assumption is that previous attempts to control the bleeding have been attempted, such as adequate first aid, cofenalcaine spray or soaked gauze, and/or cautery. If not, it may be appropriate to follow these steps first before using a rigid scope to chase the bleeding point. When using a rigid scope, ensure the stack, camera, are clean and that all light fibers are intact. To set up a rigid scope, connect to a light source and stack system if available. If connected to a stack system, ensure to perform a white balance and focus as appropriate. Use an alcohol wipe as anti-fog and lubricant as required. General tips for use include asking the patient to breathe through their mouth to prevent fogging up and wiping the tip against mucus once inside the nose to clean. In this video, we are showing you a 3-pass technique. This is the general technique used to fully inspect all parts of the nasal mucosa and is not required with an epistaxis patient where the main aim is to chase the bleeding or identify the bleeding point. The first pass is likely to be the most fruitful in epistaxis management and is the pass inferior or medial to the inferior terminate into the postnasal space. Note any prominent blood vessels, especially taking note of the septal wall. The second pass passes between the inferior and middle turbinate. The third pass passes medial to the middle turbinate to view superiorly. At all times, note any prominent blood vessels or abnormalities. During a bleeding episode or once epistaxis has settled, however, the nasal space is likely to be full of blood or formed blood clots. For this reason, guided deep suction is crucially important to clear the nasal mucosa and allow for a good view to chase the bleeding. It is usually useful to do this on both sides, especially if suspecting a posterior bleeding point, and may be easier on one side to clear the postnasal space. If you identify a bleeding point or prominent blood vessel, which is the likely cause of the patient's bleeding, deep cautery can be attempted. A way of performing this is by using a suction catheter to protect the silver nitrate portion of the cautery stick during insertion into the nose to prevent inadvertent cautery to other nasal structures. Cut the suction catheter just shorter than the cautery stick as shown and insert the cautery stick inside. You should be able to push cautery stick out of the protective cover easily once at the desired area. Using the rigid scope, apply cautery to the vessel as shown. In the video, it is being shown being exposed in the postnasal space for demonstration purposes only, as no cautery was indicated.
Hi everyone, my name's Mara. I'm one of the teaching fellows at Alder Hey doing paediatric ENT. Today we're going to go through procedural skills, and if you're doing ENT, you'll probably already have realised this, that you can't really do your job as an SHO or even a registrar without having some awareness